Hello, everyone. Today we are going to discuss a highly debated topic in the health community, whether vitamin D supplementation is protective against chronic diseases such as cancer and diabetes. Many scientific studies have been conducted, and numerous claims have been made on this subject. But how true are these claims? When does taking vitamin D make sense? Let's dive deeper into the answers to these questions. Overview. General views on vitamin D and health. Vitamin D is an essential nutrient for bone health and immune function. It is widely recommended for the prevention of bone diseases such as rickets and osteoporosis. However, in recent years, studies have suggested that the benefits of vitamin D may extend beyond bone health, potentially offering protective effects against a variety of chronic diseases like cancer and diabetes. But whether these effects are real remains a topic of intense scientific debate. The relationship between vitamin D and cancer. The relationship between vitamin D and cancer has been a subject of research for many years. Several epidemiological studies have indicated a link between low vitamin D levels and an increased risk of certain cancers, such as breast, prostate, and colorectal cancer. For example, the Tromsø study found a correlation between high vitamin D intake and a lower incidence of cancer. Oxford Academic. However, these findings are based on correlation, not causation, and therefore do not definitively prove that vitamin D prevents cancer. According to the most recent guidelines published by the American Endocrine Society, the evidence supporting the use of vitamin D supplements to reduce cancer risk is not strong enough to recommend it universally. Oxford Academic. Most clinical trials show that vitamin D supplementation does not significantly reduce cancer risk. For instance, a study involving individuals taking 4,000 IU of vitamin D per day found no meaningful reduction in cancer incidence compared to the placebo group. Oxford Academic. Vitamin D and diabetes prevention. From a diabetes perspective, vitamin D levels have been thought to play a role in blood sugar regulation and insulin sensitivity. Some studies involving pre-diabetic patients suggest that low vitamin D levels may increase the risk of developing type 2 diabetes. However, similar to cancer, the relationship here is also likely more complex. Low vitamin D levels might be associated with increased diabetes risk due to other underlying health conditions and lifestyle factors, rather than being a direct cause. Oxford Academic. Several large-scale studies have evaluated the impact of vitamin D supplementation on diabetes prevention. One such study, again from the Tromsø cohort, divided high-risk individuals into two groups, one receiving 20,000 IU of vitamin D weekly, equivalent to 2,900 IU daily, and the other receiving a placebo. The results showed that vitamin D supplementation did not significantly reduce diabetes incidence at Oxford Academic. Thus, these findings suggest that vitamin D supplements are not very effective in preventing type 2 diabetes, even in pre-diabetic patients. Who should be taking vitamin D? According to the guideline, there are four main groups who should consider routine vitamin D supplementation. 1. Children and adolescents at risk of bone diseases, particularly those at risk of rickets or other bone diseases due to vitamin D deficiency, require regular supplementation. 2. Individuals aged 75 and above. This age group is more likely to have vitamin D deficiency, and supplementation is recommended to maintain bone health and reduce fracture risk. 3. Pregnant and breastfeeding women. During these stages, vitamin D requirements increase, and supplementation is advised to support both maternal and fetal health. 4. Pre-diabetic patients at risk of deficiency. For individuals with prediabetes, monitoring and maintaining adequate vitamin D levels is suggested, although routine supplementation for all prediabetics is not recommended. Oxford Academic. Vitamin D supplementation, dosage and potential side effects. Determining the correct dosage for vitamin D supplementation is crucial. Typically, a daily intake of 400 to 800 IU is recommended for bone health. However, higher doses have been considered for potential protective effects against diseases like cancer and diabetes. Unfortunately, these higher doses come with a higher risk of side effects. High-dose vitamin D supplementation can lead to hypercalcemia, excess calcium in the blood, and is associated with kidney stones and other complications. Oxford Academic. The American Endocrine Society advises that daily doses above 4,000 IU should only be taken under medical supervision and for specific conditions. Otherwise, high-dose vitamin D can do more harm than good. Oxford Academic. Vitamin D testing and unnecessary use. In recent years, there has been a significant increase in the number of tests performed to measure vitamin D levels. In the United States, the number of vitamin D tests conducted has increased by 60 to 70 times over the past 20 years. However, routine vitamin D testing for the general healthy population and subsequent unnecessary supplementation is not recommended in the guidelines, Oxford Academic. In most cases, adequate vitamin D levels can be maintained through regular sun exposure and a balanced diet. Conclusion: vitamin D should only be recommended for specific groups. In summary, vitamin D supplementation does not provide general protective effects against cancer and diabetes. It is only recommended for certain risk groups, such as those with bone disease risk, the elderly, pregnant women, and specific prediabetic individuals. For the general healthy population, routine supplementation is not beneficial. Taking high doses of vitamin D unnecessarily can lead to more harm than good, so always consult a healthcare professional before starting any supplementation. If you enjoyed this video and want to receive more scientific information, please don't forget to subscribe to my channel and hit the like button. Remember, health is the greatest wealth. Take care and stay healthy.